Hello, this is Dr. Stanley Lang, and welcome. The question that we're going to review today is, are these neurological symptoms Lyme disease? Is it Lyme disease when one has strange neurological symptoms, especially if they're new and they're not a chronic problem? And the reason I wanted to share these thoughts today was because of an encounter with a patient who has a child that is having some strange neurological symptoms. The context for all of these sharings is whole person health model, health of body, mind, and spirit. Today we're focusing on almost purely the physical, but obviously the whole person is involved when the neurological system is impaired. So a little bit of background, the patient has had some significant learning difficulties for a while and has developed some muscular activity that are called motor tics and has some trouble with learning in school. And the patient has previously been diagnosed with Lyme disease, has a positive Lyme test. Most people with Lyme disease don't have positive Lyme tests, but this person actually did. It was strongly positive, was treated. At that time, his symptoms got quite a bit better, and the tics improved, learning improved, and then he started to decline again, and the school insisted that he go see a specialist in a major pediatric hospital, both in neurology and in Lyme disease. So the family dutifully went to see these folks, both of whom completely discounted the possibility that his symptoms that had come back were representing chronic Lyme disease, or what is called chronic Lyme disease, or recurrent Lyme disease. And the idea that is floated by the medical community is that 3 weeks of antibiotics kills Lyme disease, period. And once you have done that, then whatever's left over is no longer active Lyme disease, but it's post-Lyme disease disturbances of whatever the tissue happens to be. Now, there's a lot of problems with this kind of circular thinking. First of all, there is no one single test that diagnoses 100% of Lyme disease. So if you don't have a test that is 100% accurate, you can't compare the other tests that you use for diagnostic tests to anything to see how accurate that test is. And you can't come up with any kind of set of symptoms that is reliable in terms of saying, through these symptoms, we can diagnose this condition 100% of the time. So in medicine, we look for what are called the gold standard kind of tests, where we know for sure this is the condition based on these test results. Well, there are very few 100% accurate gold standard tests in medicine, and when doctors pretend that they are, they're not being forthcoming with what is the reality. Now, as we're getting more DNA-based tests. These tests are coming a lot closer to the gold standard, but the Lyme test is not a DNA-based test in the United States. There are some tests like that around the world, but they're not here. Therefore, we end up with inaccurate testing to start with. And then the second part of it is there's this belief that once you have the infection, that you're somehow immunized against getting it again. And so if somebody comes back with symptoms, it's just assumed with many doctors that it can't be Lyme disease. Now, doctors get browbeaten into thinking certain ways because they get threatened by their specialty societies that if they don't follow the way of the specialty society, there will be repercussions. So many people are afraid to kind of deviate from the accepted norms, and the accepted norms by the CDC currently are, as I sort of described them to you. Fortunately, there are some brave physicians who have the credentials to come out with what I think are strategies or understandings that are closer to the truth. And one of these doctors is Dr. Navina Zubčević, who is from the Harvard Medical School. Now, the Harvard Medical School is no backwater. I think most people recognize it as a very prestigious institution. And if you listen to Dr. Zupfajik talk, you know that she knows what she's talking about. And what she's talking about is that we are underdiagnosing Lyme disease significantly, and that many people who are seriously hurt by this disease aren't being treated. Now, I'm not going to get into all of what she thinks. I've never talked to her. I don't know exactly what she thinks, but I have heard some of her video content. I've read some of what has been written as her speaking. But the point is that that this is a fairly credentialed physician who has insight into the depth of this condition, this Lyme disease condition. And one of the things that she does talk about some, at least as far as I can tell, is the reality of neurological symptoms as ways that both adults and children can present. And they have diverse different ways that they can present. And the approach that I use at this point, since I live in a place where Lyme disease is extremely common, is that if I can't explain the symptoms, whether they are mechanical symptoms, that means the musculoskeletal system is involved, or they're neurological symptoms, or even if they're cardiac symptoms, if I can't explain them very well, then I assume it might be Lyme disease. And if the Lyme test is negative, that doesn't dissuade me from considering that it still could be Lyme disease, because the test is woefully inaccurate. So one of the strategies that I use is a trial of treatment for 3 weeks. Now, a lot of doctors are opposed to this because of the concern about using antibiotics excessively. But for Lyme disease, this is a very serious condition. This isn't a trivial condition. And the antibiotic that we usually use for Lyme disease is freely given to kids with acne for a whole year. Now, my thinking on this is that if we can give this antibiotic to a kid for acne, we can certainly give it for 3 weeks for somebody that might have Lyme disease. And so the idea through this strategy is if the person improves significantly, you at least have to consider the possibility that it's Lyme disease. Now, it could be something else. There are other co-infections that come along with Lyme disease that I won't get into that this antibiotic can also kill. But Lyme disease is probably a complex of multiple different organisms that sort of look the same and often include, and probably usually include, the Lyme organism. But it's much more than that. It's related to disturbances in our own immune system's ability to mount an attack against the organism. And there are many, many reasons why our immune systems are impaired, having to do with the stuff we're eating and the chemicals that are in the food that are damaging our immune response, because the antibiotic by itself doesn't kill off the Lyme organism. The immune system has to be engaged for a successful cure. That's why the strategies that I've developed are more focused on rehabilitating the immune system and helping it work at its best, and then coming up with other ways to kill the Lyme organism in addition to antibiotic therapy, or hopefully instead of the antibiotic therapy, because the antibiotics themselves have recognized downsides. But when somebody is suffering from Lyme disease badly, then at that point, just like any other serious infectious disease, the benefit of the antibiotic far outweighs the downside, in my opinion. Now, the point of all of this is to say that many people do have reason to believe that they have Lyme disease, or that their Lyme disease was undertreated. They often fall, their concerns often fall on deaf ears, because doctors have been trained that that can't be. And so until they hear some convincing evidence that's different from what they've been trained in, they're going to continue to believe what they believe. And you can't fault them for that. It's a bigger issue that's institutional. But there are plenty of doctors that do see it similar to what I've just said. I'm not in any kind of a group of doctors that think like this. I just know that there are doctors around the country that do see it a little bit differently, and they are willing to give a different approach. So the point is, if you think you might have Lyme disease, don't give up hope. There are people that that are willing to help you. And there are people with fairly significant credentials who are sort of on your side. So if you come up against a medical doctor that says that can't be that this neurological symptom is Lyme disease, or that can't be that this other symptom is Lyme disease, there are people that have significant credentials that do believe that it can be. So I hope you found this helpful. God bless and have a great day.